Ladies and gentlemen, please welcome to the stage Amy Cueva.
Hi, everyone. Good morning. I am Amy Cueva, one of the founders at MadPow and Chief Experience Officer. At MadPow, I oversee our health practice, where we work with organizations from across the health spectrum, from payers to providers, government to nonprofit, healthcare technology companies, and pharmacy companies. We work with these organizations to improve the quality of interaction that they have with the people that they serve, both inside and outside of their organizations. I'm also chair of the design track at HXRefactored. I hope you enjoyed all of the great speakers yesterday and you are prepared to have your minds blown by the amazing speakers we have lined up for you today. We want this conference experience to be as rich and rewarding for you as possible. We hope that you will learn, network, and be inspired. If you have any ideas on how to improve the conference, please do let us know. I wanted to take this opportunity to explore where we've been, where we are now, and where we're going. 5 years ago, MadPow founded the Healthcare Experience Design Conference. So we're celebrating our 5-year anniversary. Woohoo! And the mission of the conference is to explore how human-centered design and technology can improve health experiences. As designers and innovators, we are engaged by our empathy, we envision a better future, and then we figure out how to get there through collaboration, passion, and diligence. And it's that spirit of collaboration that led us to partner with Health 2.0 just last year, bringing together their developer-focused conference with our design-focused conference. And we did it. We are better together. We represent a multidisciplinary community dedicated to collaboration. We share passion and we share drive. But there are some other things that we share as well. How many of you have been seriously affected by a health situation, either personally or through a loved one? It's this recognition that led me to come to the notion that we are wounded healers in health. In coming to grips with the personal adversity that I had experienced in my own life, facing the addiction of a loved one, the diagnosis of one of my children with an autoimmune disease, going through a divorce, and suffering from anxiety, that all opened my eyes to this concept and firmed the notion. So I did a little bit of research. After having been open about my patient story through Regina Holliday's walking gallery, you saw our jackets yesterday, and giving a soul-bearing presentation at the XX Health and Health Retreat last year, and hearing the patient stories of so many, I did a little research on this concept, and I found that Carl Jung actually coined the term wounded healer. He said a good half of every treatment that probes at all deeply consists in the doctor's examining himself. It is his own hurt that gives measure to his power to heal. And we know hurt. We know what it's like to experience pain, confusion, fear, and anxiety. And those experiences give us a greater capacity to understand the pain, confusion, fear, and anxiety of another. Our empathy, those experiences, that awakening has formed a burning desire within us to make things better, to heal the system, so that other people don't have to experience what we've experienced. And maybe in the process of healing the system, we'll experience a little bit of healing ourselves. I believe that our empathy leads us to find our mission and fuels our drive. And we need that drive, because people will tell us we're wrong. If you are a lone voice, it is even more important for your voice to be heard. We can embrace our unique perspective and with the courage of our conviction, seek out others who share it and hope to persuade those who do not. We need to get comfortable being uncomfortable because change is difficult, but it's necessary. We must insist. Insist upon pretense and you'll have it. Insist upon mediocrity and it is yours. Insist upon beauty, and you will find it. Insist upon learning, and you will learn. Insist upon living with great passion, and you will see differently. All of this forms our motivation and our drive in health. I feel that our adversity, personally, professionally, and in industry, all makes us stronger and even more capable of rising to the challenges in front of us. Our industry has no shortage of adversity. We are still #1 in cost and 17th in outcomes in the world, the US is. Medical expenses still represent the #1 reason for bankruptcy. And there are so many complexities to contend with. New legislation and FDA regulations to understand, HIPAA, institutions with competing perspectives, and few easy or clear solutions. But I believe all of this helps us find our strength, and we need that strength to persevere. And we continue to rise to the challenge. We're basically a bunch of badasses in this room. There are so many good things happening, and I feel that there are core themes that will guide us moving forward. You'll find those themes represented at this conference, and they will shape our direction as an industry. We are students of the problem. As believers in and advocates of human-centered design and technology, we believe that we should involve the people who will be affected by the solutions we create in the process of creating them. Research will give us needed inspiration for the solutions we're creating. When we get outside of the four walls of our typical environment and get face time with the people we serve, we come to understand what will drive true meaning and value in their lives, what will motivate, inspire, inform, guide, comfort, engage. And we can bring others along with us in the process, others at our organization. They can participate in ethnographic studies and collaborative design processes and validation activities like usability testing, usefulness testing, desirability testing, and efficacy testing. Organizations that do this on a regular basis will gain the rich insights necessary that will fuel experiential improvements moving forward. Through research, we can understand the interplay of emotion with the health journey. The emotions of the people we serve matter. They will affect the trajectory of their path forward. Emotion can either propel or deter. And we can design for emotion. We can design to alleviate frustration and elicit the emotions that are intended. Emotion will tell us where we need to focus, where we're doing well, and where we need to improve. A spike in emotion can be indicative of an at-risk individual or an unmet need. Medical decisions can catch you by surprise. Understanding how emotion affects the decision-making process, we partnered with the Informed Medical Decision Foundation to create a decision support tool for women in maternity care so that they could get the information that they needed to make the best decisions for them. Once we understand the emotional landscape, the real lives, goals, and obstacles of the people we serve, we can look to the health ecosystem and trace their path through it, looking for unmet needs and organizations that share our objectives. The health system functions, but it does not come as close to whole health as we would hope possible, considering our human capacity to care, to connect, and to innovate. I believe that we can gather together around shared objectives. Each organization has unique objectives, but they have shared objectives as well. And we do that, we can design an ecosystem of care. We can create multidisciplinary teams. We can break down silos inside of our organization, and we can partner with organizations that have similar goals to our own. Basically, the Cindy Gallup quote sums it up. Shared values plus shared action equals shared profit, both financial and social. It's not idealism, it's good business. It was that spirit of partnering around shared objectives that led to the CDC, JSI, and nonprofit aid services organizations to get together with HIV patients and figure out what truly drives medication non-adherence in HIV and design a solution that aligns with intrinsic motivation, integrates social support, and connects adherence with improved lab results. Design has value, we know this, we're all here, but there's an awakening happening in the industry. Organizations are realizing that design can be leveraged to improve customer experiences beyond discrete interactions. In this industry, sometimes we can suffer from shiny object syndrome, convinced that the tool, the technology, will give us the answers. The technology shouldn't be our focus. It's not what's most important. What's most important is how that technology connects us with the people, tools, information, and resources that we need. We know that clinical interfaces need some help. The American Medical Association said in September that 58% of ambulatory physicians are dissatisfied with their EHR. Steve Krug will be up next discussing this very thing. But we need to also look beyond the interface and look at the workflow. We recently worked with a medical device company to design a virtual support tool for the operating room. We knew we needed to look at the workflow and design a support service offering as opposed to just a tool on a screen to get the best outcome so it would fit perfectly in the OR. The Design Management Institute has scorecarded publicly traded companies in terms of their commitment to design. Those who have enacted a commitment to design outperform those who do not by 228% on the stock market. We will continue to see customer-focused organizations lead in the marketplace. There is a maturation that happens inside of organizations with regard to their understanding and adoption of design. It goes from hitting it with the pretty stick to valuing design as an essential discipline and critical success factor, to fostering an empathy-driven culture where the customer is the focus, the patient is the focus, and that thinking is woven into business practice. The experience is a byproduct of how organizations are set up internally to deliver it. If we're a mess on the inside, the resulting experience is going to be a mess as well. As practitioners of and believers in design, we will be called not just to create exceptional experiences, but help our organizations by evangelizing the benefits of and value of design, immersing stakeholders in the process, and providing them with the tools and training necessary to aid their efforts. We recently did a week-long training initiative with a large health system in human-centered design, design thinking, and collaborative design process to help them work better together. But we also taught them how to be trainers themselves so they could extend the knowledge inside the organization and use human-centered design to solve their problems. The collaboration track this morning and the organizational design track this afternoon will be exploring some of these concepts. The world hates change, yet it's the only thing that has brought progress. Whether we're trying to change our industry, our organization, or help individuals change their behaviors, change is difficult. The convergence of design, psychology, and technology has enabled us to create solutions that will help people change their behaviors and their lives. This growing discipline will enable us to tackle any sort of personal flaw or human challenge. But there are 300,000 health apps out there, behavior change included. Which ones work and which ones don't? With all of the buzz around gamification, persuasive design, and behavior change, how do we figure this out? I think it's important as an industry that we refine how we measure behavior change so that we can prove what works and share those findings so that as an industry, our impact is amplified. In the behavior change practice at MadPow, our philosophy is that in order to facilitate lasting change, we need to look beyond the penalty and the reward and stimulate and align with intrinsic motivation. Dustin DiTomaso, who heads up our behavior change practice at MadPow, has curated the behavior change and adherence tracks on the agenda today, and he'll be up soon to introduce Dr. Jeff Williams, who will share with us key considerations for designing for behavior change. One of those considerations is to look beyond the screen and look at the ecosystem that we're designing within. In one project we did recently with a large health system, we looked at how can we facilitate better patient-doctor conversations in addition to providing the patient with the tools they needed to make change, and also engage the family in supporting them as they move forward. As governments and corporations investigate how to leverage psychology to persuade the masses, we will see solutions that tread the balance between empowerment and control. Will we create solutions that manipulate people into getting them to do what we want them to do and be obedient? Or will we create solutions that help them accomplish what they feel best about? We've been exploring ethics at MadPow and how that should guide our work, and that led a couple of our designers to found the Designer's Oath, which I mentioned yesterday. You can create your own piece of the oath and take the oath in the booth right out there in the exhibit hall. All of these themes are represented in the content of the conference, and they've also shaped how we've formed our practices within MadPow so that we're ready to tackle any challenge and drive change in health, to empathize with the people we serve through research and validation, to envision a better experience for them through experience strategy and service design, to explore how motivational psychology can help us change people's behaviors, to help organizations transform themselves to be more customer-focused through organizational design and training, and of course, to execute flawlessly across channels. I believe that design can improve the human condition. I believe that we'll be measured by our impact on humanity. We're not just selling widgets here. When I look out at your faces, people who have committed their life's work to driving change in health and improving health experiences, I get a little bit emotional. I am completely awed, inspired, and energized by all that we've accomplished and by our collective potential moving forward. I want to thank you for all of the work that you do and for being here. Thank you.